Hello and welcome to another episode of Around Town with Lily. Today I am interviewing Kara Showers, who is the youth coordinator for the Wakefield Department of Health. Hello, Kara.
Hello, Lily.
Thank you for joining me today.
Thank you for having me.
So my first question for you is, where did you grow up and did that influence your career choice?
So I am one of 4 kids, and I grew up in a tiny, tiny town of 2,000 people in the northwest corner of Connecticut, right on the Mass-New York border. And I grew up loving science and math and animals. And so that kind of led me down my pre-veterinary medicine path, and then ultimately to my public health career, which is what I'm doing now at the Wakefield Health Department. I actually became a coalition coordinator for a neighboring city back over 10 years ago when I was a young lady. And I had a youth coordinator working with me at the time. And I was very interested in the work that he got to do one-on-one, with the youth and at the schools. And luckily, the opportunity to work for the Wakefield Unified Prevention Coalition came up probably about almost 5 years ago now. And I was able to interview and get the job. And it's been such a positive experience working with the youth in this town. Absolutely love it. So
who do you work closely with in town?
So I work for the Melrose Wakefield, actually, Regional Health Department, and we have an office at Town Hall. So I actually share an office with the Wakefield Unified Prevention Coalition coordinator, or fearless leader, Catherine Dingra. And because of the work that we do in the community, we really work with a lot of organizations and all the town departments pretty much. But our work does dovetail with the police department a lot because health and safety go together. And we also do projects with maybe a non-traditional partner like the Council on Aging. The youth have presented on prescription drug abuse to the seniors at the senior center before and worked with some of the seniors there. So we get to work with a lot of different groups and individuals, and there's just awesome people we're able to partner with here.
So what do you do with the youth action team? Do you go to those places, or what projects do you do?
So the youth created sort of a mission and vision for the work that the youth action team has done over the last few years. And I love what they came up with because it just is easy for people to understand. So what we try to do as the youth action team is to grow positive flowers and shrink negative weeds. So I'll give you a few examples of projects for each of those things. So I have 2 examples of the Growing Positive Flowers projects. The first is we're able to help promote a free resource we have in Wakefield, thanks to a collaboration between the town and the schools. And it's a mental health referral hotline that anyone in Wakefield can call. It's called Interface, and we'll have the information up at the end of the show for people. It's a way you can call it up anytime. There's people who help you figure out which resources you need based on your health insurance, based on the location. Sometimes it's hard to navigate through the mental health support system, and it's just great to have somewhere to call that will actually hold your hand through the process. So that's one positive project we've been doing to get the word out about this resource that we have currently in the town. Another project that we're working on to, again, grow those positive flowers is a Park of the Month pilot project we're doing this summer. So in July and August, we're going to be at Mapleway Playground in the Greenwood area, and then we're going to be at JJ Round right on Main Street in August. And we are trying to get families to enjoy these amazing parks we have in our backyards. So it's not only great for physical health to get people out there moving around, playing basketball, jumping on, the swings or whatever, but it's really, really good for mental health too. So we're going to be having different free activities going on, but also just inviting people to come out and visit our parks from dawn to dusk.
So what's one of your most memorable moments? Would it be growing the flowers or shrinking the weeds?
So I would say definitely growing positive flowers. I feel like we're doing that every single week with our youth in the community, the middle school level and the high school level. But memories are always made at the Youth to Youth conference every summer. Since we have received our federal grant money that we have to run the Wakefield Unified Prevention Coalition, we've had some funding, and we've also collaborated with businesses in town and other fundraisers to pool together money to send our youth to this Youth to Youth conference in Rhode Island. It's a 4-day conference in the summer, and Lily, it's amazing from day 1 to day 4 how much the youth grow and change and like come out of their shell and are like, they're already amazing going into it, but coming out of it, they've just blossomed into these amazing kids who can take on the world. And it's I feel like every summer that's the most memorable thing that I'm able to experience with them. But I also want to tell you 2 shrinking negative weeds projects that we're also working on, just a couple more examples. So you go to the Galvin,
yes,
and you told me you have seen the bathroom newsletter.
Yes,
do you remember the name of it?
The Daily Flush or something?
Yes, so
yes.
close. So it's the News Flush.
Yeah.
And the youth create bathroom newsletters, the News Flush at the Galvin, and then it's called the Bathroom Buzz at the high school, so you'll see when you get there. But it's a way for the youth to share the right information with their peers, because, you know, hey, you're in the bathroom, you're going to read it, you're sitting in there. So what we wind up putting in there is a lot of different fun things, but also really debunking some myths that maybe are going around. And generally, the youth in Wakefield, most youth, middle and high school, are doing the right thing. They're not using, they're making positive choices, most are. So sometimes the perception at schools is that, you know, oh, everyone's vaping, everyone's doing this, but when you actually look at the data, we see most kids are not doing it. So we want to get that information out there. So that's one of our shrinking negative weeds projects. And then the other one, actually, I have to say, you know, thank you to Wakefield Cable Access TV, because we've been able to produce 4 public service announcements to talk about the dangers of vaping and juuling and bowing and all the names that it's called. Every day there's a new term for what's happening with vapes, and we've been able to create public service announcements for adults, and then some most recently for peers. So that's been another really fun project that we've worked on that also is helping kind of get the right information out.
So I saw you used to work with people that had substance abuse problems. Could you tell me what was going through your head the first time you heard them talk about what they were going through and their issues?
Yeah, it's so heartbreaking and heart-wrenching to hear any family talk about, you know, their struggles, whether it be, you know, in the immediate family or the extended family. You know, I know personally there's been some extended family substance abuse issues in my world, and, you know, it's just devastating. And I think that the good news is there are resources out there, first of all, like the Interface program I was talking about. And then if you think a little bit more upstream, you think about prevention. So prevention is trying to give our kids the skills, the knowledge, and, you know, the confidence, really, to try to avoid substance abuse problems later in life. So, and changing our environment that we're living in to make it easier for people to avoid, you know, trying substances and going down that path. So if we can make it harder for youth to get alcohol, if we can make it harder for youth to get their hands on vapes, then we're going to avoid some substance abuse problems later on. So my passion and my dedication is really for the young people and preventing things from happening in the first place.
What was one of the ways you were able to prevent kids from vaping or using drugs?
So we have a really active Board of Health, and they are able to pass certain policies to make it harder for our young people to go into these vape shops, first of all, and to buy the things that the data shows are marketed at young people. So all the flavored, there's all sorts of flavors out there, cotton candy, things that kids would be interested in, right? So the Board of Health has been very active with the coalition and the youth to try to put policies in place so that kids can't access these things as easily as they could. So,
what's one of your main priorities for the kids you meet?
So one of my main priorities is really making young people into leaders. So I work with already such amazing kids. I feel like every day I meet a new Wakefield kid that I'm just blown away by. But we really want to give these students skills that they need that will really take them to the next level, to be able to really lead and create change. So every week we are working on public speaking with our youth. We're working on leadership skills, meeting facilitation skills, so that they can really create and own positive changes down the line. And we try to, whether these are those mini training opportunities every week that we get to work on, just in our weekly meetings, or taking them to that conference I was talking about is another bigger example of the way that we can get these future leaders more and more skills to lead.
What was a major point in your life when you realized that you were really dedicated to helping people come out of substance abuse?
So I think I would say it was in my 20s, which I would like to say was only a few years ago, but it was more than that. Substance abuse prevention and prevention in general, chronic disease prevention is one of the many directions I could go with my public health degree, and it really suits me. I get to work with all different kinds of people. I get to feel like I'm making a difference in people's lives, individually and in the community. And I think that really preventing these issues and then helping to create, along with everyone here, that next resilient generation that's going to be able to lead us through. That's really my passion.
How did you realize that you were making an impact on these kids?
I love when I saw that question, because I was like, Lily's so smart. She's already thinking about impacts. We do, and this word scares some people, but data. We're always looking at data. We have to, because we want to see if what we're doing is working and what else can we do better. How can we shift things to make sure we're reaching our outcomes? So we gather data by, they call it quantitative data, by doing a survey with adults or young people. We gather qualitative data, which is, if I'm doing key informant interviews with people over and over again, or a group, like a focus group, that would be quantitative data. And we sort of take all of that and look at it and say, is this matching up to where we want to go, or do we have to do some changes? So we are always looking at data. It's so important.
So my mom has type 1 diabetes, and I saw that you worked with people that had diabetes. So what type do you work with, and how do you make their lives better with working with them?
So one of the grants I work on, actually in Melrose and Wakefield, is the Mass in Motion grant, and that grant is part of a statewide movement to make it easier for people to make the healthy choice. So it makes it a little bit easier for people to eat a little bit less, eat a little bit better, and it makes it a little bit easier for people to move a little bit more. So we're trying to actually reduce the incidence of type 2 diabetes, because that's the one that is more closely related to your weight and your active or non-active lifestyle. But we're not only trying to reduce the type 2 diabetes incidence, but also other chronic diseases. And we're working hard at changing that environment, like we were talking before the interview. It's one thing just to tell people, hey, you got to eat. People know they're supposed to be eating fruits and vegetables. But if it isn't easy for them to access those fruits and vegetables, if people don't feel comfortable walking on the sidewalk in their neighborhood, they're not going to want to go walking, Yeah. So we look at it from a little bit of a bigger perspective, more the environmental perspective, and make those environmental conditions amenable to people being able to do what we want them to do, right?
So is that how you motivate them, or how do you motivate them, making them want to bike around or run, or just generally go outside and help themselves get out of their diabetes situation?
So I think that there's little things that we can do. We try to partner with a lot of organizations and departments because we can't operate in a bubble. We're not going to be able to impact Wakefield in that way. One example of trying to change the environment is putting bike racks around at different locations where people say, hey, bikes are all over the lawn here. Can we get a rack so people can come and feel like they have a place to lock up their bike? And it encourages people to make that choice when they know that infrastructure is there. We work closely with DPW and the town planner to make sure that when we're reconstructing a neighborhood in town, that we're thinking about all users of that neighborhood, not just cars, but people with strollers, walkers, bikers, everyone. So that's an example.
So I saw that you went to Boston University. So did you originally want to go there, or did you have other colleges in mind?
So I only applied to BU School of Public Health for my grad work, and was just thrilled when I got in. And they have a great School of Public Health, and the grad campus actually has the medical campus, the dental campus, and the School of Public Health. And I was really lucky. I worked in a lab right on campus and was able to work and then take classes at night. And so it was very convenient, and just thrilled when I got in. And I learned so much during my tenure there. So
I saw you got a degree in pre-veterinary medicine. Did you originally want to become a vet?
Yes, I always wanted to be a veterinarian since I was little, and I grew up in that tiny town I was telling you, and we had so many different animals. We had a llama, actually. We had sheep, horses, cows, chickens, bunnies, goats. We had it all. We didn't have pigs, but we pretty much had everything else. So I was very interested in working with large farm animals and thought that I always wanted to go to vet school. But as I got a little older, I realized I really wanted to work with people in the community, and I didn't think a veterinarian career would allow me to do that as much as I wanted to. So I switched paths a little bit and took off on the public health avenue.
So I also saw that you got a degree in epidemiology. So how do you use that in your current job, and what is it?
So, such a good question. Epidemiology is kind of a weird word, and you pronounced it perfectly. So, epidemiology is really the science of tracking how and when people get ill. So, we do use epidemiology every day in the health department where I work, and I can give you an example of that. So, if someone calls the health department and says, I ate at this place, down the street, this restaurant, and I feel awful, here's what happened, that triggers us to employ our epidemiology work and figure out who else got sick, where did they go, what exactly did they eat, what were their symptoms, did anyone else get sick, what was going on with the employees there. So kind of building that whole picture so that we could prevent anyone else from getting that foodborne illness. So, and epidemiology really does tie in with the prevention of substance abuse rates and, chronic disease rates. So we really want to prevent folks from getting these diseases. And so we're always looking at the trends that we're seeing and who's getting sick, why is it happening, and are there ways that we can put a policy in place or bring people together to solve this problem. So even though I don't consider myself an epidemiologist anymore because I've been in the community health realm for a while, we do use epidemiology every day. And so now you know that word, you can say it at school. It'll be cool.
So my final question for you is, if you had one thing to tell middle schoolers and high schoolers, what would it be?
I think I would have to say two things, because I think there are things I carried through middle and high school, and I guess my parents were the ones that kind of put them in my head, but I think it's always do your best and be yourself. So I think that's going to really, if you could keep those things in mind, I hope that brings you to the happiest, healthiest life you can live. So that, I guess those are my ending thoughts.
Thank you, Kara, for being here today.
Thank you for having me.
And I will see you guys next time on Around Town with Lily.